for some patient expectations. In order for us to move through the process as quickly as possible, it's important that you communicate with your coordinator, that you keep your clinic and testing appointments, make sure you get your dental evaluation and clearance early. Please coordinate your routine health maintenance with your primary care doctor. If you are selected for heart transplantation, you'll be added to the UNOS, which stands for United Network for Organ Sharing Waitlist. UNOS is a private, non-for-profit organization that coordinates heart transplantation in America. They coordinate the matching and placement of organ donors, policy development, and education. Every organ donor in the United States is registered with UNET, which is a national transplant computer matching system. We enter information from your evaluation, including your blood type, height, and weight. It is important that you have regular cardiology visits and blood work while on the wait list, so this information is current. Also, it is important that you notify the team of any changes in your health status. We enter any antibodies that you have. When a good match is found, the donor details are viewed by the team on the website. The process for transplant matching can take a while, a year or two even. Once listed, we will need to be able to contact you at all times. Because once a heart is identified, we'll need to contact you within an hour. And if we cannot reach you, the heart will go to the next person on the list. If you do travel during the waitlist process, we would actually have to temporarily inactivate you. You don't lose your place in line, but we inactivate you for the period while you're gone because you wouldn't be able to come in for the organ. We would reactivate you when you get back from vacation. Once the organ is accepted, you'll be notified of the potential donor. We use the word potential because the surgeon who goes and procures the heart has the final decision on whether the heart is good enough for you. After you receive the call, you will need to come to the hospital within 2 hours. Even after being admitted to the hospital, the transplant could be canceled if the surgeon is not happy with the quality of the heart. Once the heart is removed from the donor, we have about 6 hours for the placement into the recipient. Sometimes the donor organ is considered to be increased risk. For instance, if the donors have participated in high-risk behaviors that can increase the risk for disease transmission. Examples would be recent incarceration, unsafe sexual behavior, or IV drug use. We may be offered a heart from a high-risk donor. Also, we may be offered a heart from a donor with known hepatitis C. In that case, you would be able to decide whether you would want a hepatitis C heart, where we would treat you for the hepatitis C infection after heart transplant. You can choose to not accept a high-risk hepatitis C donor without any penalty on the wait list. But there are benefits of increased risk donors. You can get a heart sooner, reducing your risk of dying while waiting for a heart. We will talk about your preferences ahead of time. In the next videos, we will cover the heart transplantation procedure and what you need to do after a heart transplant.